Ang COVID-19 ay panibagong kontrabida sa buhay nating mga Pilipino.
Habang unti-unti tayong bumabangon muli, patuloy ang laban natin dito.
Para matalo natin ang kontrabida, we can beat the solusyon.
Kaya mong maging bida, basta susundin ito.
B. Bawal walang mask.
I. Sanitize sa mga kamay. Iwas hawak sa mga bagay.
D. Dumistansya ng 1 metro.
A. Alamin ang totoong impormasyon tungkol sa COVID-19.
Protektahan natin ang sarili at mga mahal sa buhay.
BIDA Solusyon sa COVID-19.
Paano ba maging bida sa panahon ngayon kung ang kontrabidang dapat talunin ay COVID-19? Ganito ang BIDA Solusyon!
B. Bawal walang mask.
I. Isanitize sa mga kamay. Iwas hawak sa mga bagay. D. Dumistansya ng 1 metro.
A. Alamin ang totoong impormasyon tungkol sa COVID-19.
BIDA Solusyon sa COVID-19! Paalala mula sa DOH, PCOO, IATF, NTF at USAID.
Maayong gabi sa atong mga followers of the Facebook pages of the Department of Health Central Visayas and the Philippine Information Agency Region 7 sa Cebu, Bohol, Negros Oriental ug Siquijor. Maayong gabi and welcome to another episode sa ato ang BIDA Solusyon Virtual Presser. Kini si Rachel Nesha gikan sa PIA Region 7 and I will be moderating once again ang ato ang BIDA Solusyon nga virtual interviews with resource persons nato gikan sa Department of Health nga muhatag nato og mga updates on COVID-19 nato nga cases dinhi sa Region 7 as well as public health advisories na angay ihatag sa ato ang public especially on katong mga public health diseases na nagpadayon gihapon karong panahon na bisag na ay COVID-19 pandemic. So for our episode karong adlaw ato ang virtual presser karong gabi una ato ang bisita na ay ato resource person first of all of course ang ato ang spokesperson for COVID-19 in the Department of Health Central Visayas. Ano na ni nato ang ato ang naging mainstay, regular mainstay every time sa ato ang BIDA Solusyon Virtual Presser. Si Dr. Mary Jean Loreche. Maayong gabi, Doc. Welcome once again sa ato ang BIDA Solusyon Virtual Presser.
Hi, Miss Rach. Maayong gabi sa imo ha. Maayong gabi sa tanan nga ga-follow aning ato ang programa, no? And so we are again very excited. Every week, apparently, we're always excited to be with you so that we can give you always the good news, no?
So, later on, before we ask Dr. Loreche, no, sa ato ang mga unsay update nato mga good news gikan ni Doc, we will also have ato ang resource person for the second topic nato sa ato ang virtual presser ang kining TB World TB Day ug atong observation of National Lung Month kay nagpadayon man gihapon nga naat mga TB cases dinhi sa Pilipinas, especially dinhi sa Region 7. So we will be asking ato ang second resource person later on atong Medical Program Coordinator for Tuberculosis sa Department of Health Central Visayas, si Dr. Sharon Azanit Laurel. Later on, we will be asking her for updates on TB cases dinhi sa Region 7. But before that, atong pangutanon una si Doc Loreche kung unsa man ni Doc, unsa na may atong updates, good news gihapon Doc on COVID-19 ato nga sitwasyon dinhi sa Central Visayas.
Yes, Miss Rach, no? So sa mga tagapagsubaybay, no, sa ato ang programa every week, no. Again, let me give you a run through with our data, no, for the week, no. So as of August 25, our data says that our total confirmed cases is 18,439. Our total active cases is 2,756 and the new cases is 68. So you can just imagine 68 na lang ang ato ang bagong mga positive cases. And if you break it down, only 7 for Cebu City. So single digit na kita, Miss Rach. Isn't it amazing, no? So single digit as of August 25, no? For Mandaue, single digit din, 7. for Lapu-Lapu, gamay gihapon 11. It's the Cebu province that has quite a few, no, an increase in the number of 40. And then for Negros Oriental, Bohol and Siquijor, wala sila'y natala nga bagong mga kaso. So you can already see, no, nga mura wapo na gyud hayag na kayo ang atong kaugmaon.
No, Doc, no? Ang kanang yung kang single digit, murag wapat ako na Doc, for Cebu City, aning single digit na to nga mga cases. But good job yun kayo sa Cebu City, Doc, no? Nga we were able to really bring down drastic yun nga pagkanaog, no? Sa ato ang mga kaso din sa Cebu City niya. Doc, kanang, kung sa may pasabot ni Doc, murag, hayag ang kaugmaon, hayag sa ani next week, Doc, kay last week naman karon of August. So there
Well, actually, Miss Rachel, no?
Currently not classification one.
Yes. We are very excited for next week, no? But there's one thing gusto lang na ako isulti, no? I was interviewed siguro last week, late part of last week, no? And they were asking me kung na-flatten na ba ang curve nato diri sa Cebu City. And I was so shy to saying na na-flatten na. So aningon lang ko nga, there is already a lowering of the curve for us. But looking at our numbers consistently, no, being low, I would say, no, na we have flattened our curve here in Cebu City. So, unsa man ang paingnan nato ni ani niya, it can only mean that by September 1, we might be placed already in the most lenient type of community quarantine, and that is the MGCQ. And we are really looking forward to that para slowly ang atong business industries can also be opened up. And then people can have work again, and then we can have a livelihood for everybody, changing again the landscape in the way we live as Filipinos.
Doc, no, na-mention mo, Doc, kanang the possibility that we will be downgraded to MGCQ by next week. And since naka-GCQ ta currently, daghan nang naghinay-hinay ug open up, no, sa mga establishments, and I think more people are now also reporting to work, no, in the offices since GCQ. Naaman to reports, Doc, especially in Cebu City nga transmission daw is murag mas higher karon in the workplaces. Tinuod ba ni Doc?
We don't really have concrete data, Miss Rach, no? But what we do is this. So there are instances wherein, and we know, no, it was also in the news, no, na naagihapon lagi industry where they do have positive cases for their workers. So the possibility gyud tinuoray, no, nga kaya ato namang na-control ang sa community, di ba? That's why we have these very low numbers of positive cases now. What we're looking at right now, and we are focusing on, and I would like to congratulate the Emergency Operations Center of Cebu City, no, under the leadership of Mayor Labelia and with General Mel Feliciano and Ma'am Mia, no, and all the team members in the EOC. They are very, very meticulous and doing their job, trying to do a follow-through and going into the nitty-gritty of the cases. And yes, that is correct. They have informed us nga itong most recent nga ilang nakitaan nga nag-positive na medyo nagtaas ang number is actually attributed to the workplace. And so diha mo sulod karon, Miss Rachel, ang atong mga good news again, no, that the business sectors are also getting themselves prepared for the MGCQ. That is why naagi mga projects, no, I'll mention one, the Project Balik Buhay, wherein they are creating guidelines, no, which is corollary and in alliance with the IATF, the DOLE, and DTI guidelines, no, whereby workplace health standards will have to be put in place, including the testing in the workplace. So with all of this being planned out and being implemented, I believe nga we will be able to move forward really with our opening of the economy.
Okay, that's good to hear, Doc, no, nya. I know na medyo dako po no ang responsibility gyud sa ato ang mga employers right now to prevent gyud the spread of COVID-19, especially nga mao to imong giingon, Doc, nga slowly opening up na ato ang ikaw na. So Doc, I'd like to ask Doc regarding the pooled na to nga mga testing kay murag na report naman to na announce naman to lately Doc that DOH will be doing this. Can you give us backgrounder on this Doc?
Okay. Sa Manila, no, they started with this project, ang Go Negosyo, with I think RITM, no, and the Department of Health. They actually conceptualized doing the pool testing primarily for the workplace. And so kita diri sa Department of Health, we have started our own pilot study. Kay while we are waiting for the guidelines coming from DOH Central on the pool testing, kita mismo naghimo kita, Miss Rach, diri sa ato ang DOH nga CTRL sa atong molecular lab. So last week we did that, no, we piloted the Department of Health itself, the different units. And so we were able to come up with our own findings, our own protocols and guidelines for the pool testing. And I am actually endorsing the pool testing based on our studies on the results of what we did here in the Department of Health, which our RD, no, si Regional Director Jaime Bernadas, Dr. Bernadas, is actually amenable for us to do this. And as a matter of fact, I came from a meeting with the mayor, no, Mayor Labella, on the pool testing. So we are going to go ahead with it. We are just waiting for the go signal from DOH Central to proceed. But pool sampling is a very good tool that we can use, especially for areas where there is low resources for the PCR, areas where gamay lang ang transmission for diseases or low ang ilang prevalence, and then areas that are in the workplaces, no, labi na if it is for surveillance purposes. Gwapo ang pool testing for surveillance purposes, especially for workplaces, tungod kay magnaog manggod ang cost nimo in terms of cost per individual in running the test for the PCR. So we have come up with the guidelines. I'm just waiting for RD Dr. Bernadas to sign it out so we can actually roll it out already.
Okay. Pero Doc, unsa ni siya Doc? Have you already identified Doc kaniki mong murag pilot nato nga mga areas dinhi atong buhat atong where we will first conduct the pool testing?
Yes, so Ms. Rach, no, we did that here in the Department of Health itself. So the first government agency that we did it with is our own Department of Health. Kasi I wanted to see pila gyud kabuk ang akong gwapo nga samples mo gawas wherein I would be able to maximize it. And so I found out that a group of 5, no, or batches of 5 samples to be run as one for the pool testing. And it was very successful. So kung positive siya, ang imong sample, you will have to do an individual testing of that batch only. Kapag ka negative ang imong result, you can release the entire batch as negative. Okay, so it's not premature to announce, but it is true that this coming Thursday and Friday, we will actually try it out in the carbon market, no? So ang atuang target area, the pilot area for us, no, in coordination and collaboration with the city government of Cebu City and the Department of Health will be the carbon market, no? Kasi dugay naman ni namo nga giplano nila ni General Mel, no, nila ni Doc Michelle diha sa EOC, in which we want to make sure lang so that that area can be alive again. People will be confident when they go there, no, nga di sila mahadlok nga they would be able to get the virus in that particular busy area.
Okay. Pero after sa move on, napatay laing areas na gi-identify
Yes,
for the
definitely.
testing.
Yes, Miss Rach, definitely. Either it will be under the program nga i-roll out ni Go Negosyo, nga ilang i-pilot ang Cebu City. By the way, there was already a MOA signing last week, no, a virtual signing for the Go Negosyo, targeting 4,000 to 5,000 individuals, no, that will undergo testing using the pooled sampling methodology. So once nga mahuman na ang ilahang protocols and guidelines for Go Negosyo, I believe we can do and roll it out here in the city of Cebu.
Pero Doc, this is purely voluntary ang mga tao nga mo appeal ani?
Yes, just like any testing, everything has to be voluntary. Kasi we cannot force the testing on people who are, shy of doing the testing. But we do encourage everybody to have themselves tested for the sake na lang of number one, nakahibalo sila kung unsa ilang estado. Number two, to keep their family safe when they go home. Number three, to keep their co-workers and co-employees safe when they go to the workplace. No? And number four, it is because when we love each other, nagpakabana kita, then we will have ourselves tested.
Thank you kaayo. Daghang kayong salamat, Dr. Mary Jean Loreche. No? Daghang kaayo tang good news gikan ni Doc. Not only ang katong single digit for Cebu City and nagpadayon nga nagkaubos ang atong mga kaso, but also kini ato ang initiative kaning bag-o nga estratehiya karon no nga i-implement sa DOH ang pool testing. So hinaunta ang nagtan-aw nato karon, ma-encourage ka mo no nga mo appeal ani kay actually ako nakapaswab ko lately Doc nya. First, mahadlok pero muna no, wala hindi angay kahadlukan ani nganong daghang na gihapoy mga hadlok magpa-testing ba nga there's nothing to fear no, but knowing that you are negative or whether you're positive, at least kahibaw ka no kay dinha man magsugod no, awareness of what you have or what you don't have. So Doc, to wrap up ang ato ang himuhang updates karon no Doc nga gihatag, unsa may ato ang advisories or mga mensahe karon Doc sa publiko now that we are in the last week of August and we are entering na the start of the Burr months Doc no, next week na. Go ahead Doc Loreche.
We are very excited because the Burr months are here. That means it's gonna be Christmas very soon. And we are looking forward to a positive celebration in the new normal for Christmas, di ba? So, ang ato ang i-advise sa atong mga tao at pagpahinumdum would be number one, let us continue on disciplining ourselves and continuously doing the BIDA solution. Do not forget na we have to be living the new normal by washing our hands, wearing of masks properly, wearing of the face shields properly also, physical distancing, and stay at home if you have nothing important to do outside. Secondly, ako lang ipahinumdum sa ato ang mga members, no, nga gapananaw sa ato, Miss Rachel, kaning you might be hearing about the word reinfection, no? So, naana karon no, it's circulating around the fear na basi ninyag infected ikaw, naulian na ikaw, and then dahil magkasakit ka because there is a case already, no, nga ilahang ginastadihan din sa Hong Kong. But as of the moment, we really need a peer review of this, no? So there has to be a scientific-based and evidence-based medicine muna on the studies of tinuod ba gayon nga naagi reinfection. So meanwhile, let us not be kampante because number one, hinumduman nato nga kung negative ka karon, it does not give you the license to be negative the entire time of your life. Ha? You can be negative now, but tomorrow, kung dili ka mag-amping, you will become positive. And if on the other hand, you are also positive, it's not the end of the world. Ha? Because if you are going to seek consultation, you are going to do isolation, especially kung nakigibati and then mahadlok ka nga magpa-test, pero mahadlok ka mo at hospital, mahadlok kang mahibalan nga positibo ka. And yet you feel that you may have it based on the symptoms, pag-isolate na lang sa panimalay nimo, pag-amping, no, boost your immune system, take care of yourself, and of course, kung dili na gyud kaya, like naglisod ikaw ginhawa, seek medical consultation immediately. Kaya ang tanang bagay manggod na manay pamaagi para matambalan kita.
Yes. Thank you. Daghang salamat kaayo, Dr. Mary Jean Loreche, ang ato ang spokesperson for COVID-19 from the Department of Health Central Visayas. Always a pleasure, Doc, to be asking for updates from you, no? Especially good news naman ta kanunay recently. And we'll see you again next week, Doc, for another round of interviews and the promotion, Doc, no, sa ato ang mga public health nato nga mga advisories and kaning BIDA solusyon nato nga mga tips angay natong padayuno no nga i-practice nato whether sa balay or karon no nga naa na sa opisina kalabanan ang mga tawo because naka-GCQ ta niya. Maybe, hopefully, by next week, MGCQ pa yun. So, more work ato ang personnel, more per people will be going out no to the offices and their business establishments. So sa nagtanaw nato karon gikan sa Bohol, Negros Oriental, Cebu, Siquijor, no hinaot unta. Hinumduman ninyo ang gisulti ni Dr. Loreche nga magpa-test mo walay angay ikahadlok ug unsay resulta dali lang na ata gihapoy mga programa no na ay mga facilities and services na in place ang Department of Health o ato ang mga health facilities din kayang-kaya nato na nga ma-address no ang ato ang mga kung natin mga COVID-19 cases pa nga magpadayon diri sa ato. So daghang salamat Dr. Loreche. We will see you again next week, Doc. Unya karon we will move on to the next topic nato ang ato ang World TB Day ug ato ang National Lung Month celebration kay the month of August mao man kinino ang gi-designate gi-set nga mga health related nato nga mga observations for the month of August. So ang ato ang sunod nga bisita mao ning ato ang Medical Program Coordinator for Tuberculosis of the Department of Health Central Visayas, si Dr. Sharon Azanith Laurel. Maayong gabi, Dr. Sharon, and welcome sa atong BIDA Solusyon Virtual Presser.
May gabi, said ma'am. So actually, ang August is Lung Month. The celebration for the TB Day happens every March 24.
Okay. So
August is actually Lung Month.
Wita mo na unang pangutana pud nako Doko no kay nag-wonder pud ang uban ani nga Lung Month siya pero nganong TB daw ang focus. So I thought ako ang explanation is that because TB is one of the top diseases affecting the lungs. Sakto ba ni Doc?
Yes. Basically, may reason no nga focus gihapon sa during the celebration of Lung Month, we focus more on TB because until now, ang Philippines is still identified to be a high TB, no, and not just high DSTB but DRTB burden country.
Oh, okay.
So and then we are also gearing towards supposedly elimination, no, pero so mo na siya nga as much as possible intensify nato ang campaign for the for ending TB.
Mao day na Doc no nga naagid tay gi-designate gid no nga usa ka bulan for the lung month nato, National Lung Month, and then katong World TB Day nga imong giingon Doc nga next March, but again matakol gihapon siya no mabalik gihapon siya sa public awareness ini ka August. So ako lang ipangutana Doc, una unsa man ka grabe ato ang kaso sa TB not only in the Philippines but also dinhi sa Region 7 Doc no. So mangayo ko Doc og mga updates nato Doc on the data cases in Region 7 Doc kung increasing ba ta Doc or decreasing?
So actually, nationwide, we have the TB incidence of 554 per 100,000 population. So if you have 100,000 Filipinos expected, you have 554 of which is a TB case, no? So last year, as of 2019, wala ta naka-attain ana sa atong case detection rate, no? The accomplishment for 2019 region-wide for Central Visayas, we were only able to detect as much as 50%, no? 50% of that target. So for 2019, we were able to detect 21,797 cases, TB cases, out of the supposedly 43,650 cases unta nga atong pwede ma-detected TB cases, no? Considering the 554 per 100,000 population nga TB incidence rate.
Doc, you said no nga 21,797 ang cases nga na-detect nato for 2019 in Region 7. This is only 50% sa target nato nga. Doc, unsay reason ani Doc nga wala na reach nato for 2019 ang ato ang case detection rate?
So basically kanang some of the areas would claim nga wala na dyan cases sa TB daw. Although, ang strategy man good nga nahimo for the past years is passive TB case finding, meaning most of the time, we wait for the patients to come to the health centers and consult, no? We would like to, the advocacy now is to conduct active case finding. So supposedly for the 2019, ningsaka na ang tatupadong atong cases kay we were conducting a lot of active case finding, no? So what is active case finding? We go to the community, no? We bring along with us chest x-ray, mobile chest x-ray, so that katong mga individuals identified to be a presumptive TB case is subjected to x-ray, and then if ever the x-ray finding turns out to be suggestive of TB, we refer them to gene expert, which is our diagnostic tool for TB now. So mounta to siya. And then mo start na sa dunta pag 2020. Unfortunately, early or first quarter of 2020, we have the COVID situation, of which wala na nato gi suggest ang mga LGUs to conduct active case finding, no, for safety reasons also.
Itong inyong dimension, Doc, na mobile chest x-ray na to nga kaning mga sakyanan. I understand, Doc, akong ani is it's a naa siya sa sulod sa usa ka vehicle. This is owned by DOH, Doc, o naa ba ni sa mga LGUs nato?
We have one mobile van in our regional office. Unfortunately for now, dili siya functional ang x-ray machine, but we are not operating yet because mag-secure pa tawag LTO. Pero for the 2019, what we did was we contract out mga chest x-ray providers, no? So most of the time that was funded by the Global Fund, and then part of which also funded by the regional office.
I see. Okay. So Doc, before I ask for the cases for 2020, katong imong gingon, Doc, nga 43,650 cases na supposed to be unta, no? Mao to siya a target ninyo nga ma-detect by last year sa 2019. Unsay gibasihan ato, Doc?
The basis would be the population of the area. No, you multiply the population of the area by 554, no, 0.00554. So mo na siya ang imuhang target nga population for testing.
Okay, so it's a different target, moving target siya, Doc, for each year kung based siya sa population.
Yes. Ang target would be basing on the population, and then for testing, we would like to test as much as 3% of the population, 2.5 to 3% of the population, meaning if you have a population of kanang 100, 2 to 3 of which should be referred to gene expert, no, makasubmit siya plema para testing. So 2 to 3% of the population should be tested for TB.
Okay. And good for 2019. So, karon, Doc, since 2020, nagsugod man ang pandemic nato, no, COVID-19, I think started, ang lockdowns nato started March, sometime March. Mungutana ko, Doc, kamusta man atong cases, Doc, from January and the latest data that you can give us?
So for the first quarter of 2020, we were actually able to detect as much as 54% of the target, no? That would be 6,032 TB cases out of the target that was 11,091, no? So that was good enough kay usahay makaingon man ta nga taas jud kay 554 nga target good per 100,000 population. So 54% of the accomplished case detection rate in Q1 is murag acceptable na siya, murag okay to siya nga case finding initiative. Unfortunately, because we started with the lockdowns during the last part of the first quarter and then the entire second quarter, ni dive jud ato ang case finding initiatives in the second quarter, no? And then with that, we were only able to detect as much as 23% of the target in the second quarter of 2020, no? And that would be 2,570 TB cases, no, out of the supposedly 11,000 nga target. No? So which is kanang kuan lang sad siya, ato alang sa na siyang gi accept, no, kay we cannot put our healthcare workers kuan bitaw at risk, no, nga ato jung i-push, and also our patients nga ato jung i-push ang case finding nga naa sila risk for exposure, no. So ato lang gi hinayan lang sad atong case finding initiative atong second quarter and even until now.
So Doc, with the katuno ang atuang cases na detect nato nga nakuha nato for first quarter and second quarter, Doc, can you give us siguro, Doc, a breakdown per province? Asa man, Doc, although one nato nakuha atong target, but asa, Doc, ang areas or provinces in Region 7 nga taas ang atuang kaso?
So for it depends also na mga provinces nga taas ang atong cases basically because of the kanang kuan sad population, sad taas ang population, no. So for the first quarter of 2020, ang taas gyud nga na reported would be Cebu province, no, that accounts for 2,143 TB cases, no, and that is actually 48% of their target, no? And then next would be Negros Oriental province, no, accounting to 1,144 TB cases, and that actually is 58% of their target, no. And then of course mo come in ang atuang ang Bohol, Cebu City ang actually third, no, a highly urbanized city. We expect na naidaghang case detection because of work-related migration also. So for Cebu City was able to report on around 760 TB cases in the first quarter of 2020. No, and then next is Lapu-Lapu and then Mandaue. And then last would be Siquijor.
So Bohol, Doc, na-mention mo that would be after siya sa Cebu City, ang Bohol, or
yes,
before siya?
Next, yes. Ang Cebu City comes in third with 760 TB case detected, and Bohol would be
follow.
Ay, naguna di ang Bohol sa Cebu City. Ang Bohol was able to detect 955 TB cases. So and then Cebu City with 760, and then Lapu-Lapu with 555 TB cases, and then we have Mandaue City with 389 TB cases detected. And then Siquijor with 86.
So, Doc, kini nga figures, are we medyo, unsa may ato ang ani, Doc, assessment, although considering na naatay lockdown, no? But even with the lockdown, Doc, kita numbers that we're seeing now, these are still lower gihapon sa unsay ato ag yung expected unta.
Oh, yes. This is actually lower. Kaya ang ato arang pinakataas nga accomplishment would be Mandaue City, no? They were able to accomplish for the first quarter of 2020, of which wala pa to'y mga lockdown ato dinhi sa atong region, atong first quarter. No, they were able to accomplish 70% out of target for case detection. And what is unfortunate about that is in the second quarter, ang accomplishment na lang sa Mandaue City, no, nga supposedly taas kay gini ilang case detection every time, no, kay may mag-initiatives yun, actually everyone, no, all the provinces and all the issues is may mga initiatives. Pag second quarter ning kuan yun, dive yun ilahang mga case detection.
Okay. Doc, na-mention mo ganihan, Doc, no, nga, where it's still a burden, no, ang TB is still a burden sa atua dinhi sa Philippines, and yet this is a preventable, Doc, and a curable disease. So, unsa, Doc, nganong hangtod karon, Doc, it continues to be a public health disease dinhi sa atuang nasud, Doc, ang TB?
Maybe because there's still a stigma, no, stigma towards TB. And then also, TB is a chronic disease, no? It's unlike COVID nga acute siya, kanang paspas ang iyahang progression sa iyang symptoms. TB, if you feel karon giubo ka, and then it's not always nga naa kay ubo. Sometimes Filipinos are, as we are, naatay tendency nga dili dayo yun mangonsulta only when kanang murag na anay lisod na pagginhawa, no? Pero dugay na kaayo ka supposedly nga infectious and is infecting others. So that with that, dugay ka nang konsulta, positibo na ang taka sa TB, daghan na kag natakdan before pa ka nagpatambal, no? So the advocacy was and still is unta, if you have cough and you are identified to be a kanang vulnerable population, part of the vulnerable population for TB, you are urged to go to the health center or a DOH facility to have yourself screened and actually tested for TB.
Okay. Pero ang kanang pag-test, Doc, kanang mo adto sila no sa facility sa RH sa TB dots. Unsa man na, Doc, how does unsay procedure nga they have to go through? Kay uban mo way mahalukan nila kausahay no nga basig sakit na ay pain involved in the testing ba. So unsa ni testing nga buhaton ani, Doc?
So, kuan kanang first step would be screening, no? I-screen siya for symptoms and then for the presence of cough and high risk hiya or moderate risk for TB, moto plema ra gyud ang kinahanglan niya ihatag for pulmonary TB, no? Magsabit siya duha ka specimen container nga plema and then minimal ra ang amount nga atong pangayuon ana and then maora at iyahang i-submit nya, mag-wait siya. Most of the time, if dili kay taas ang atuang acceptance rates sa atong mga specimen to be processed in a day, ang results sa testing would be out in 2 hours, no? Pero for kuan, ang atuaan ang gihatag nga average within 3 days, no? The most would be 3 days na iyang result. Pero for extrapulmonary TB, sample, sample of the katong asa nga organ involved, no? For extrapulmonary TB, but for pulmonary TB, we ask only for plema.
Okay, for plema lang, sige. Kani siya, Doc, so meaning it doesn't take 30 minutes nga classes sa pag-collect, no? Ang paghatag ani. Dali ra kaayo.
Oo, dali ra kaayo siya, pero sometimes manggod na ay ubo nga, dili siya productive. So dili siya inana ka productive ba, so it takes time, but we also suggest nga ang early morning specimen man good is the best specimen, no? As much as possible kung maka-provide ang patient, we suggest kana iyang i-collect as specimen 1 or at least one of the specimen should be an early morning specimen.
Okay. But in the rural health units, Doc, the testing is for free or nabaybayaran ani?
The services for TB is actually free, no? Even in our private mga facilities, no, that we certify, DOH certified private facilities, the services should be free, or kung namangay fee, it should be at the minimal because we are providing them with all the diagnostics, no, and also the medication. So for if ever the patient prefers to be seen in a private facility, in a DOH certified, DOH certified private facility, minimal ra iyang fee ana. Pero kung moadto siya on our health centers, most of the time, kuan jud, free jud ang TB services, no? Even TB treatment.
Okay. So, libre, dayon, dali ra ang procedure, walay sakit, no? Kay muubo lang ang pasyente. So, hadlok, no, ang pagduol ngadto sa atong mga rural health units kay dili siya hassle, no, and it doesn't take money and time, a lot of time for the testing sa procedure. Pero Doc, unsa man gyud ang kay karon, Doc, rainy season, common kaayo, Doc, ang kanang flu season, no, kanang common colds nga gitawag sab, Doc. How kano sa nimo unsa puntuha, Doc, sa imong symptoms sa usa ka tawo nga gibati niya nga moingon siya nga magpa-check na gyud siya or magpa-testing siya for TB. Unsa man ang symptoms nga kalahian, Doc, from the common cold lang kanang nag-cough lang siya?
So the recommendation yun is to seek immediately, no? Be it mag-contemplate, especially karon there is COVID, no? As much as possible, if you feel the symptoms, you seek consult in the nearest health center, no? So dili na ka maghuna na basin TB ni huwaton lang sa nako mulala no. Worst karon especially during the COVID situation, mas better good even if you have the mildest symptoms, you seek consult. And for TB also, especially if you are considered to be a part of the vulnerable population, no, kinsa man tayong vulnerable population for TB, the young and the old, no, ang katong mga senior citizen, and then katong children nato, and then katong mga people also nga ato naa sa kanang confined nga mga spaces, no, or kanang mga highly congested nga areas like the jails, or you are diabetic, you are a smoker, or you are in long duration nga on steroids na, or you are immunocompromised because you're a cancer patient, no, or on dialysis, you are a highly susceptible for TB, no. So if you have even a day's cough lang, we suggest you go to the health center for screening and for possibly testing.
Okay, so inana no kanang especially sa imong gi-mention Doc nga naa namang with tay pandemic nata in the middle of a pandemic, so wag gyud mawala nato kung maniguro gid no o pa-check up. Yes. Yeah, no, regarding atong imong giingon no nga naay mga immunocompromised sila, usually Doc ang TB na sakit naa ba ni siya Doc kaning common age kung asa ni siya, especially dinhi sa sa Philippines or dinhi sa region kung naatay data Doc, unsa man usually ang age Doc nga kaning naaning TB, magkasakit din sa TB?
So most of the time the data would tell us nga TB is very common amongst the working population age group, no. Basically because it is common sense nga kuan man working population kuan sa sila increased risk of exposure. So mao na kay pero mas lagawas kay nagtrabaho, no? So mao na siya ang atuang kanang taas nga mga cases ang mga working nga age group, no?
Cause for concern siya Doc no kay especially sa atong mga parents, mga mama papa nga nagtrabaho no nga kana kaayo nga age ba niya kung masakit ka sa TB, pila ka days nga dili ka maka trabaho muna mawala ng income loss on those hindi sila maka-work. Doc, how about ang death rate aning TB Doc?
So actually for Region 7 kay wala ko'y kaning data on kanang sa death related TB related nga mga deaths as of now, no, pero still amongst the katong kay most of the time dili naman jud kaayo although taas gihapon ang TB related deaths, pero dili na gid siya mo ikatong murag pinaka factor na gid bitaw nga namatay ang patient. Although diri sa Pilipinas manggod kung ang patient gi-TB maski nagpa-tambal na unya naligsan, ibutang gihapon nga ang namatyan TB, which is kind of unfair, pero the true picture is dili na gid ana kataas ang atong TB related deaths, particularly because we have been kanang proactive, no, in sa ato ang campaign towards treatment, no, and immediate treatment.
Yes. Yeah. I understand also Doc diba kanang DOH nga programa nato especially kaning mga TB dots nato no ang mga facilities kanang sa treatment Doc, is that for free? Is that shouldered by the government ang kanang treatment costs ani? Kay basig usap ko na Doc sa mga rason nga dili ba mo padayon sa ilahang treatment or di na lang gyud sila magpa-check up kay mahadlok sila nga positive kay mahal ang treatment, but unsa man Doc na ang cost ani sa, because I know it takes a certain pila ka is ang treatment niya.
So for the drug-susceptible TB, we have at least 6 months treatment, no? And that is for free in the DOTS certified facilities, no? Or the entire duration of treatment, libre na siya, no? And then we have also the drug-resistant TB, of which as of now, because the drug-resistant TB nga program is supported by the Global Fund, treatment is also for free.
Okay. So ang 6 months Doc kinanglan humanon gyud na sa usa ka pasyente or kung mo-drop siya along the way Doc, mohunong
yes, we encourage patients, no, who have been initiated treatment, they should comply, no, until the end of treatment and until they are declared cured by the health worker. Kaya there is a tendency, like what I said, I mentioned a while ago, nga the Philippines is identified to be a high DSTB, meaning drug-susceptible TB and drug-resistant TB burden country, no? So the tendency is the risk if during the mid part sa imuhang kaning treatment niurong ka kay nawa naman imong symptoms, which is common amongst us, no? Kung magpa-treat dili na ta mag-inom sa tambal kay wala naman ko giubo, wala naman ko gihangos, no? But that is not an assurance nga namatay ang TB nga bacteria, because your TB bacteria is a slow growing bacteria. There is a tendency the symptoms are gone but the bacteria itself is not totally dead, no? So it takes around 6 months for that bacteria to, there is an assurance nga patay gud siya and there are no dormant bacteria anymore nga mo reactivate anytime soon, no? So ang TB actually is kanang kuan siya, kanang common siya amongst the immunocompromised, no? All of us man siguro Filipinos are exposed to TB, pero you can wonder nganong wala man ko gi-TB. Wait na lang, kung ikaw murag na time nga may immunocompromised ka, there is a tendency to for that TB nga naa nimo which is in a dormant stage, no, inactive stage nga mo reactivate. That's why the TB program now is also muratag we are intensifying our advocacy for the treatment for latent TB infection, no? So for those individuals, makaingon ka, ala, akong papabaya sa una na ay TB, so you were exposed to a TB case, you are recommended, it is a recommendation nga all individuals exposed to an active TB case should be treated for LTBI, no, for the TB preventive therapy, which will also last for as much as 6 months. But we have a combination now for prophylaxis, which will run only for 3 months, no, 3 to 6 months treatment. That is a prophylaxis, meaning prevention, because you were already exposed, and there is a tendency for you to activate, to become an active TB case. Come a time, no, especially most of the time mag-activate ang atuang TB during kaning kuan senior citizen years, no? Makakuang ka lagi TB, mga tiguang kanang immunocompromised nga mga years nato. So we advocate nga if you were exposed, you have to have a prophylaxis to give you that protection, no, so that you will not reactivate, no?
So, Doc, kining imong giingon, Doc, nga bisag sa una nga nag-take care siya of naa siya exposure to a TB patient, at bisag mga inunta 5 or 10 years ago, Doc, kinahanglan gihapon kini nga certain individual dapat subject gihapon siya into the katimong giingon, Doc, nga prophylaxis?
Actually, taas na sa na ang 5 to 10 years, although pwede raman good, no, pero mao sa na kanang we have man sad mura bitawag atong kinsa ang atong ma-enroll karon. We have a criteria kung kinsa atong ma-enroll karon sa atoang TB preventive therapy. So for now, para sa dili kalas tanan ang atoang mga logistics, no, ang katulang kuan close contacts of the enrolled TB case. So kanang active part of the treatment for TB is panalitan akong mama gi-enroll as a TB case, so the healthcare worker should ask sa katong iyahang gi-register as a TB case kung pila sila kabuk sa balay, and then or sa iyahang trabahuan, and then kuan to sila i-screen to tanang iyahang contacts, no, meaning x-ray ha, no, i-assess for the presence of TB. If ever amongst the contact gali walay on active TB, so all of the contacts should be enrolled under the TB preventive therapy, no, under the prophylaxis, which for now ang atong gigamit sa program is isoniazid, no, katong isoniazid preventive therapy, but we have other agents on for this year na sa taylaing mga agents, no, we use kanang mga combination.
Ang preventive therapy, Doc, preventive therapy na ito nga programa, it's also still for free, kana siya.
Yes, it's
libre
also for free.
Siya.
Yes, libre siya.
Yeah, Doc, ako ipangutana because kanang it's also the observation of National Lung Month man nato, no? I remember kanang murag sa mga strategy sa messaging sa DOH ang kumusta baga pangutana. Oo, so ako karon Doc kaning dinhi sa Philippines aside from TB Doc, unsa pa may lain natong common Doc nga mga diseases related nga mo affect sa lungs?
So, common kanang mga upper respiratory tract infections, no? Mga pneumonias in ana. So, pero kuan man na sila treated man with antibiotics, the same with TB, no? So, kana mga community-acquired pneumonias, mga COPDs, no? Mga common sana siya. And of course, karon ang atong COVID.
Yeah. How yes, Doc. For how do we keep our lungs healthy, Doc? So may buhaton na to.
So it's common, common knowledge na it's common to all. Prevention is always better than cure, no? So lifestyle, no? And kanang i-boost nimo imong immunity kay the moment na ubos imong immunity, that's when affected jud ka to everything nga you're exposed with, no? So lifestyle, walay mga bisyo, no? As much as possible kaya na mga bisyo. And then kanang kaon og sakto, no? And prevent sad imong exposure, no? Pero dili man gid ma-prevent ang exposure, na lang gyud imuha is i-modify imong lifestyle. As much as possible you live a healthy lifestyle.
Healthy living, Doc niya. Isulti ka, Doc, no? Katong walay mga bisyo niya. Kaning uso manggudron, Doc, ning mga e-cigarettes kay na I remember na himo ni siyang murag uso sa mga batan-on, no? Mga millennials nato ang mga vape, no? Vaping ilahang tawag man ani, Doc. Mangutana lang ko, Doc, unsa may ato ang advisory for those who are using e-cigarettes?
So the same thing katong na previous nga issuance ang DOH nga dili siya safe. It's just like the cigarette smoking, no? Nga kanang if you can do without it, better. So if katong cigarette gali which is from tobacco nga atong gikuan nga natural siya, naagay siya side effects sa lawas, how much more kaning nga mga vapes, no? Kay it comes in mura man siya mga synthetic, di ba? Chemical based siya. So naagid siya effect sa imong lawas. It is just relatively new. That's why dili pa inana kanang daghan ang mga researches or studies nga bitaw findings on how it will affect us. Pero ang mga studies nga ang gamay pa nga mga studies karon is gyud kanang ang iyag yung finding is it has mga bad side effects sa imuhang lawas. So we are not recommending as much as possible we avoid, no, the kanang mga vapes.
Vapes. Kay naamong uban, Doc, mo claim nga it's mura kunog healthier daw siya nga alternative to the kaning unsa ba tawag ani traditional nga mga sigarilyo, no? Katong cigarettes gyud mo na mag-vape na lang daw sila. So dili day ni tinuod, Doc, from the medical there's no research that supports that find.
Yes, so far walay research nga ni support nga it has an advantage to the body, no? A few researches now on vape kanang ang findings it has a disadvantage on the ones who are using it.
Okay. So, Doc, siguro, Doc, to wrap up ato ang discussion, no, regarding world itong TB cases, no, ang prevalence ani nga nagpadayon gihapon ni siya nga public health concern dinhi sa Philippines and especially dinhi pud sa region nato unya mo ni, no, naapektuhan lang ang ato ang programa, ang implementation because of the lockdowns amid the COVID-19 pandemic. Unsa may imuhang mensahe, Doc, for those who are watching us today?
So first and foremost is nagpasalamat mig dako sa PIA, no, kay with your help dako ang amuang na-reach with this amuang mga campaigns for TB, no. And then I would like to remind everyone nga ang TB nagpabilin nga dako nga problema sa Pilipinas, no, and is affecting a lot of Filipinos, no. Actually mas taas gali ang deaths nato sa TB compared sa recent kay nato nga COVID. And also kato ang services for TB is for free, and we are murabitag enjoining everyone nga kanang kuan ang TB nato nga services na continuous siya, wala siya naurong, no. So if you have mga symptoms related to TB, dili na to ikauwaw, no. Ikuhaon na to ang stigma for TB, moadto din tato sa health center kay ang TB dali maayo, no, og malikayan.
Daghang salamat Dr. Sharon Azenith Laurel, ang ato ang Medical Program Coordinator for Tuberculosis from the Department of Health Central Visayas, no. So sa ato ang nagtan-aw nato karon, daghang salamat, no, for joining another episode sa ato ang BIDA Solusyon Virtual Presser. Nga you heard earlier, no, from Dr. Mary Jean Loreche, ang ato ang spokesperson for COVID-19 from the Department of Health Central Visayas, who gave us updates ato ang COVID-19 karon, latest nato nga mga updates ug advisories from the Department of Health, and of course ang ato ang nagpadayon gihapon nga programa, no, sa TB ug kampanya nga mahimo na yung zero TB cases, no, TB free na gyud unya ang Pilipinas, hopefully soon, no. And unsay mga gibuhat sa DOH aron mapadayon gihapon mahatag ang libre nga serbisyo for those who are afflicted with TB. So kini si Rachel Nesha gikan sa Philippine Information Agency. Nagpasalamat sa atong mga viewers for watching us tonight for another episode sa ato ang BIDA Solusyon Virtual Presser. Catch us once again next week for another round of updates gikan sa atong mga resource persons from the Department of Health. Daghang salamat. Ug maayong gabi natong tanan.
Ang COVID-19 ay panibagong kontrabida sa buhay nating mga Pilipino.
Habang unti-unti tayong bumabangon muli, patuloy ang laban natin dito.
Para matalo natin ang kontrabida, we can beat the solusyon.
Kaya mong maging bida, basta susundin ito.
B. Bawal walang mask.
I. Isanitize sa mga kamay. Iwas hawak sa mga bagay.
D. Dumistansya ng 1 metro.
A. Alamin ang totoong impormasyon tungkol sa COVID-19.
Protektahan natin ang sarili at mga mahal sa buhay.
BIDA Solusyon sa COVID-19.